by Liberal member for Mackellar Jason Falinski and Independent member for Warringah Zali Steggall. Good morning to you both and a belated happy Christmas.
Merry Christmas,
Merry
Catherine.
Christmas.
So we know all eyes in the last couple of days have been obviously on the northern beaches. It was split in two for the north and the south with some of those more relaxed restrictions for Christmas. Jason, I'll begin with you. What did your Christmas look like, being someone who lives on the beaches?
Look, I was very lucky. My parents live within the biosphere that we have up here on the northern beaches, so we were able to go and visit them. But there were a lot of people north of the COVID curtain who were finding it tough because my brother-in-law, for example, his mother was on her own because his father's in a nursing home in Turramurra. But true to our community, by the end of the day, she was invited to lunch down the end of the street. So, you know, people were reaching out and making sure that everyone was okay, consistent with the health orders that are in place.
And Zali, what about you? Which part of the northern beaches COVID curtain are you on, the north or the south?
Look, I'm actually in the south and my parents are also in the south, so they were able to come over for Christmas lunch. We were 7, so we were under the 10 people limit, and the other half of the family got together and they were 9, so they fit under the 10 as well. So it was difficult, but look, I think everyone, like Jason said, made the best of it, and we've seen already great really heartwarming reaching out within communities and people coming together to still celebrate Christmas and give thanks.
Zali, we saw those numbers yesterday, 7 cases, new cases that were announced, but a huge number of tests, over 60,000 or almost 70,000 tests. Do you think that the New South Wales government has got the settings right? Because, you know, you do speak to some epidemiologists, and if you look at it purely from that perspective, their restrictions would be a lot more strict.
Look, I think it's really interesting to see the high level of testing says to me anyway that there's a fairly good we can have fairly good confidence that we're detecting cases in the community and that we don't have too much undetected cases in the community. I think the northern beaches has been exceptional in that willingness to get tested. I'm probably more concerned about the growing list of places that are now identified, which is the broader Sydney area, not just the beaches, and whether those areas are as willing to get tested as the northern beaches has. So the New South Wales Health doesn't release the data around locations of where people are from that are getting tested. So are the 60-odd thousand mostly northern beaches? Are they broader Sydney? You know, they must have that data that gives them confidence of what areas are really engaging with the testing.
Jason, I wonder your opinion on this localised lockdown that we're seeing in the northern beaches. Of course, as Ali said, there are other areas that are now starting to get infected, but they are smaller cases. But what do you make of these localised lockdown? Is that the way to go going forward, rather than, you know, shutting the borders, which the Premier has said was an overreaction on many of the states and territories' parts?
Yeah, Fazia, that's a really great question. And look, I don't have training in epidemiology, so I don't want to be accused of ultra-crepidarianism, but it's fair to say that New South Wales has demonstrated during this year that their use of data, their use of science has led to world best outcomes in terms of maintaining a relatively COVID-free environment. It's certainly true to say that some of the earlier outbreaks we've had in July and August this year, they managed it through postcodes, so very targeted lockdowns. And I think that's what we saw from the Premier 2 days ago, where she got far more nuanced about who was being locked down, what areas were being locked down. And what Zali was saying is absolutely right. The data, as far as I can see, demonstrates that the overwhelming number of cases are actually confined to Avalon or the postcode 2107, which is really unfair and completely, of all the places in Sydney that you would expect to see an outbreak, Avalon would not have been in my top 1,000. But having said that, all of the outbreaks that we have seen and some of the other hotspots we have seen have been able to be traced back to Avalon. So we seem to have a good, or the New South Wales health authorities seem to have a fairly good bead on where this is coming from and how it is getting to where it's going. There have been a number of cases, very few, about 6 out of about 110, where they've had some trouble tracking them down, but 4 of those 6 are still from people who live in the Avalon area. So at the moment, you would have to say they'd have some level of confidence. But of course, they've taken a very precautionary response throughout this crisis.
Jason, in all the interviews I've ever seen you in and read that you have conducted, you always spruik the fact that there's a need to listen to and adhere to the advice of health experts. And many of these health experts are now urging the mandatory face mask policy. And yet this is something that you don't agree with.
Well, look, I think the experts are divided on it. So you're quite right, Fazia. There are about 30 to 40% who seem to be arguing in favour of mandatory face masks. All of them are advocating the use of face masks. But where a lot of people are landing, and what seems to have worked in New South Wales, as opposed to other jurisdictions around the world, is that if you treat your people like adults and not like inmates, you get far greater cooperation and far greater buy-in for the health measures that you're taking. At the moment, and I'm sure if this wasn't working, that the New South Wales government would move from a setting of suggestion to one of mandatory. But my observation, and I'm sure it's the same for Zali as well, my observation was when the New South Wales government advocated that people wear face masks indoors, there was almost straight away 100% compliance with that here on the Northern Beaches. And I don't know about other parts of Sydney because I have been locked in into the Northern Beaches. But yeah, that would be my observation.
Zali, you're responding with a nod of the head there?
I'd have to agree. Look, the difficulty with making it mandatory is how do you police it? So you're arresting people on the footpath, people being sent home. I would say there is a vast majority of people that are complying, that are wearing face masks. I think when you're out exercising, that's a little more difficult. But as soon as people are indoors, certainly shopping around the Northern Beaches, everyone's been wearing masks. I think, what was interesting is we saw footage of people celebrating Christmas on Bondi Beach, for example, and there certainly weren't many masks or much social distancing going on. So I think clearly everyone has to really focus on getting the message to their area and making sure everyone is doing absolutely the best they can for social distancing and wearing the mask. Look, I've spoken to Professor Mary Louise McLaws and she strongly advocates for it. But again, and the risk of contagion, that we should be aiming for being COVID free. But I do feel we're striking the right balance between enabling people to do the right thing without becoming a complete police state. I think there is, I think we do need to entrust people to do the right thing. It is ultimately in their best interest. They don't want to fall sick and not be able to receive good medical care in our hospital system.
Zali, if we can move on to the impact of this micro lockdown in the Northern Beaches on businesses, which then can be extrapolated out across the country, because we know that outbreaks like this have happened before us and they may indeed, hopefully not, but they may happen elsewhere again. How are the businesses on the Northern Beaches feeling? Is the messaging right from the correct bodies and government authorities, and are they being supported enough?
Well, it's difficult because obviously this lockdown for the Northern Beaches has come at a time where it's 2 weeks of shopping over Christmas. It has impacted the sales and the way retailers are feeling. I know the Premier is calling for Boxing Day shopping to be done online, not in person in the shops. So that has a major impact on our local economy, especially the Northern Beaches where we do rely heavily on tourism. So I have called for the government to really consider a hotspot lockdown related package so that it's not just Northern Beaches, it's wherever a lockdown occurs. If it occurs for more than 7 days or 14 days, that has got a serious impact on business. And we have employees have assistance through pandemic leave, but businesses themselves don't get assistance. We have JobKeeper, which has reduced in rates, and I think a one-off payment would ease a lot of the pain for businesses. They're seeing their their workforce in mandatory isolation for 14 days. So businesses not only have doors shut, they also, if they had an ability to continue trading, have lost a lot of their workforce. So I do feel we need to help them be there for when we come through the lockdown.
Jason, of course, the Northern Beaches outbreak is just the latest, but this could happen anywhere in Australia. Of course, we are living in the pandemic. Do you think there needs to be clearer guidelines for businesses when a localised outbreak happens, of what happens when they shut down and when they are gearing up to open up again?
Yes, Fazia, I do. And having said that, I think one of the things that I would point out is that we're never going to get this right. We've already seen that there are now mutations in the virus, and there are further measures having to be taken in other parts of the world. The important thing for us to realise is that mistakes will get made, and that we correct for those mistakes as quickly as possible before they get out of control. So, before I fell in with an interesting group of people, I used to run my own business. I know that what businesses on the Northern Beaches want is a short but very quick lockdown so they can get back to business. The federal government has thrown hundreds of millions of dollars in supporting the economy over the last 9 months, 12 months it'll be by the time that comes off, and we need to be in a position whereby we can ensure that businesses are able to and continue to trade, because we can't continue to afford to throw the sorts of money that we have. We'll be paying this debt off for at least a generation, if not more. So it's important that we learn to be adaptable and resilient, and I know that businesses, especially small businesses, are up for that challenge.
Well, Jason Falinski and Zali Steggall, it's been great to have you both on the show to discuss all things Northern Beaches Cluster. Thank you so much for joining us. Have a great Boxing Day.